As a parent, I keep hearing about parent training. I meet with my BCBA every now and then to review my child's progress. Is that the same thing as parent training?
Very, very, very good question. To be very honest, it's not. Parent meetings, as you described, are the times that you meet with your BCBA to discuss your child's progress, if they made any regression, if they're making gains, where they're at, if they need to discontinue services, if they need to increase in hours, that sort of thing. Those are the types of things that get discussed there. Parent training can be part of your parent meeting, but is also something separate. And what I mean by that is parent training is you being trained essentially on how to work with your child from your home setting, your community setting, your grandparents' house, your parents' house, whichever. It allows for you as the parent to know what to do in the moment. So, for example, if your child has a meltdown and you want to know how to respond, you shouldn't have to rely on the BCBA or the RBT to be present every single time. You as a parent should know how to respond in the moment, such as, keep maintaining that calm voice, making sure they're safe, and also to making sure that you kind of go through the debriefing process with them after. You as a parent can be equipped to do that. As well as you as a parent should be equipped to know what antecedent strategies are, or what behaviors to look for, what triggers to look for, precursor behaviors. All these words I'm throwing out are words that you should be familiar with, but you will only learn them really in parent training. Now, granted, some parent meetings are more informative than others, meaning that as you're talking about the treatment goals, the BCBA can go through and explain, what these different terminologies mean. But in parent training, it's literally as it sounds. The parent has the opportunity to practice the skills. So it's no longer just this theoretical portion of it, but it's also an application portion. So when now you as a parent, quote unquote, go to generalize the skill to your child in the home setting, community setting, wherever, you're not stumbling, you're not struggling. It becomes like second nature because you've been practicing it. So I would say reach out to your BCBA, reach out to your clinician and say, hey, what is parent training and how can I become part of it? Because I want to become more equipped on how to parent my child from the home setting, and most importantly, carry over the skills that they've been learning in ABA therapy. I hope you have a great day.